Okay, so today I just need to get some shit off my chest. Like, I've had such a shit weekend. I cried all day Friday to the point I was so upset that I forgot to fill my NDEB script. And so I had 2 tablets left. I had two 10 milligram tablets left. This is slightly crooked. And then Monday was Australia Day. And then I forgot that it was Australia Day because I was so upset. And then I had 2 tablets left. I had a 10 milligram tablet on Sunday night and a 10 milligrams tablet on Monday night. And I was just so upset. And then I was dizzy and nauseous all on Monday, like all Sunday, all Monday, because I had gone from 20 milligrams to 10 milligrams. Anyway, I'm back on my tablet now. I went and got my script and like I feel back to normal. So like it took probably a few hours. Like it didn't just magically happen, but like I still felt a bit nauseous when I woke up this morning, but by now this afternoon I'm feeling reasonably good. Only a little bit nauseous, but I just so frustrated. Like I had an appointment on Friday, a phone appointment with the gynae clinic, and then they rang up and cancelled it. The doctor refused to speak to me. I found out today it was a doctor who cancelled my appointment, not the receptionist. Like she was ordered to do it because the doctor said this woman hasn't had her PCOS test done yet, so I'm going to cancel her appointment. And it was like, I've been in chronic pain. I've had backache. I've had back pain. I tried to get an MRI. I had a panic attack in the MRI because the hospital wouldn't even let me take my Valium like with enough time. They said you can't have your Valium until you get here. And like then I took it and then like okay, into the MRI machine like 20 minutes later, and I'm like, I need like a little bit of time for this to kick in. And so I had a panic attack and I didn't even have enough Valium in my system anyway. I literally took like 5 milligram tablet, which doesn't do anything like if you're panicking. So you know, I'm just so frustrated. I can barely even put my words together at the moment. I'm so upset. Like I understand that there are people who have cancer, okay, who need the appointment. So there's a triage system. So if you don't have cancer, you're on the 1 month to 3 months. If you've got cancer or they think you've got cancer, like you can get in a bit quicker. But I'm upset because the hospital booked me an appointment. I told the gynecologist I want to book in for an ablation at my next appointment. They gave me a phone appointment, which they shouldn't have done. They should have booked me a face-to-face. I had to wait 6 weeks for that appointment. I couldn't get the PCOS testing done. I had my son transitioning from one medication to another, stressed out from withdrawal symptoms, and then like just not doing okay. So I had to look after him, busy with him. Then I was in pain myself with constant period pain, constant PMS for 5 months straight. And it's like, do you think I feel like being poked and prodded by an internal ultrasound? Do you think I feel like having a glucose intolerance test or whatever it's called and sitting there feeling sick for 2 hours when I'm already struggling with nausea and I'm already feeling sick? You know, because my fibro makes me nauseous. When I get my period, I get nauseous. And then they're like, just take progesterone. It's like, that made me nauseous. You know, it's just been this ongoing thing. And it's like, I've had no quality of life for so long. And I'm just so frustrated. Like, it's been going on for so long. I went to the doctors about 18 months ago, 2 years ago, and said, my periods aren't right, something's wrong. And he said, that's fine, it's normal, it's fine. And then another year went by, and then things were getting worse, and I said, something's wrong, I need an internal ultrasound. And he's like, it's just your low iron, just go and get an iron infusion. I said, low iron doesn't cause belly pain and all the symptoms that I'm having. So then I went and got an ultrasound, and they said you got hyperplasia with possible polyp. And then they were harassing me to come and get the surgery. And then I had COVID and the flu, and they were harassing me saying, you need to come and get this surgery done. You need to come and get this surgery done. And I was like, I can't. I've got bronchitis and I've been up at the hospital. I can't come in and have this surgery. And then finally got to the point where they rang me again. I was like, I'm literally recovering from, like, I've been in hospital, but I'll come in and see you about having the surgery. And then the surgeon said, we'll do a spinal block because you've been so sick. And then he didn't write it on my paperwork, and I said, you need to fix my paperwork, and he said, just tell them on the day. And then on the day I got there, and they said, you're having normal anesthetic. I said, no, I'm not. I'm having a spinal block because I've been in hospital with bronchitis. And then, yeah, they had no bed for me, and I rang them the week before multiple times and said, you know, you don't have a bed for me because you haven't changed my paperwork. And so I ended up in recovery for 8 hours. I didn't regain feeling in my legs until like 1 o'clock in the morning. Then I went into bladder retention. I couldn't go to the toilet, and they wheeled me up to sleep in the old, like, elderly patients, like, I don't know what you call it, where all the elderly people are. I had to spend the night in the old age ward, I think they called it, because they had no bed for me. And so they fucked me around with that. Like, whatever, the actual procedure went okay, so that's fine. Like, at least it wasn't a muck around with the actual procedure. At least that all went right. It was just that my paperwork was stuffed up and they didn't have a bed for me. And then I had to talk to the anaesthetist when I got there about how I was supposed to have a spinal block. And there were these two elderly ladies who went in the morning, and they were like, we're having spinal blocks, and they went in early. And then I was the second last patient to go in at 5 o'clock at night. And I'm like, you know, then I couldn't walk till 1 a.m, you know. So it just makes you lose so much faith in the hospital, in the system. I was like, I'm trusting you to knock me out and tinker around with my body, and you can't even fill out my paperwork correctly. I'm just so frustrated. I've had my period for 5 months, and I'm so completely over it. I am so over it. And I've been going back and forth about, do I want another child? Do I want another child? Do I want an ablation? What do I do? And I've come to the decision that I'm going to get a Mirena and an ablation. And I feel at peace with that. I feel like this massive cloud of like relief comes over me now that I've made that decision, because I'm 40, be 41 in April. I've got 3 children. My eldest is like going to be 20 this year. You know, like, I've been there, I've done that, I've raised my babies. And when my daughter will be 11 this year, you know, like, that part of my life is over. And I had hard pregnancies, and it took me a long time to recover because I had such difficult pregnancies. So I've just had this chronic health for so long, and it's like, I'm fighting so hard to get healthy. I've had to see a gastroenterologist, I've had to see a gynecologist, I've had to see a rheumatologist, and it's just never ending. It's all I do is go to the doctors. And I've had enough, and I don't want it anymore. I want to be healthy. I'm joining the gym next week, and I am feeling better. You know, the NDEP is helping my stomach, and it's helping my fibro. So, and the H2 blockers are helping. So, I am slowly getting better. I just need my period to stop so that that's not causing me like PMS and backaches and inflammation, because every time I get my period or I'm bleeding, I'm just getting inflamed, and I'm just done. And so the fact that they cancelled my appointment on Friday just broke me, because I'm like, I've been waiting 6 weeks for this appointment, and now I've got to wait another month. Like, so they booked me in March for an appointment. But yeah, it's just the waiting. It's just the constant waiting, and it takes so long. Like I said, if you broke your leg, they go, oh, your leg's broken, and you get it fixed, and that'd be it. But when you got things like autism and fibro and ADHD or PCOS, things like that. It just takes so long to get a diagnosis, and then you're at risk of developing depression or anxiety in the meantime because you get medically gaslit, or you have to wait, and then you get treated like you've got a mental health issue. And it's like, I mean, but then they're treated as if you've only got a mental health issue. They're like, oh, well, you've got depression, that's what's causing it. It's like, no, I've got depression because no one's listened to me, because I'm in chronic pain, because I'm bedridden, I can't get out of bed. My life is passing me by, and I'm only in my 20s, only in my 30s. Now I'm only in my 40s, and it's like, how much time has to pass by before you accept the fact that I have a chronic illness? I mean, I've been trying to get diagnosed since I was in my 20s. Like, I remember I'm sure I was in my 20s when I asked for an arthritis test. I know I asked for a couple in my 30s. I'm pretty sure I asked for one when I was about 25 as well. You know, now I'm going to be 41 this year, and it took 15 years to get diagnosed with fibromyalgia. Like, it's just unbelievable that no one listened to me. In 15 years, nobody listened. You know, it's just so upsetting. And there's no apologies, there's nothing. You can't get that time back. I can't get that time back. I can't get back the lost friendships. I can't get back the lost experiences, like everything that I've lost so much due to being sick a lot. And I know that it'll get better. I know that I'm on the right path, and this is another reason why I want an ablation, because I'm done. Like, I can't spend 2 or 3 years restoring my health, getting all the surgeries, or having all the tests, getting whatever I need done, join the gym, get fit, and then have a pregnancy and lose that fitness, lose that health. Because every time I've had a pregnancy, it's been traumatic on my body. When I had my daughter, I had gestational diabetes, and that messed me up for a long time. When I had my son, I almost ended up in a wheelchair because I had it's like this thing where in your pelvis or your muscles become loose because your body secretes too much of the relaxant hormone, and I was in agony just taking steps because it was, I don't know what caused that. It's a hormonal thing apparently. I didn't have it with my son, and I was advised by an obstetrician not to have any more children because I had it so bad with my son. I didn't even have it when I had my daughter. I had gestational diabetes instead. So, you know, I've had rough pregnancies, rough labors. I haven't had a good experience, and I'm traumatized from it. You know, some people have babies and they have an easy pregnancy, they have an easy labor. That has not been my experience. And then on top of that, I've been dealing with fibromyalgia and stomach issues, and now uterus issues, whatever you want to call it. And I haven't been listened to, and I've been suffering for years, and I've just been popping pills because that's what the doctors gave me. I had a camera down my throat twice, and they said we can't see anything. And I've just been given painkillers since I was in my 20s, you know. I've just had enough. So my plan is to go and have a bunch of testing done. I'm having a CAT scan next week. I'm having a couple of breath tests to check for like bacterial overgrowth. I'm having I don't know what else I'm having. I'm just doing all the testing that I can get done to rule things out. But like I said, the NDEP is helping, the H2 blockers are helping. So it seems like, you know, I've got histamine issues. I take an antihistamine every day for my stomach and a general one. That's helped. The H2 blockers helped more than anything. That and the NDEP. And the NDEP is for the nerves in the stomach. So, you know, at least I've finally gotten some relief from that, because being told that you're suffering from depression and you need an antidepressant when you're presenting for physical pain because you've eaten something and then you've gone into a physical spasm after you've eaten food, that is not depression. That is not depression. And NDEP, yes, NDEP is an antidepressant, but I am on the lowest dose for pain because it is also a pain medication. Like, I haven't even gone up to the 25 milligrams yet. But yeah, 10 I felt a tiny bit of relief, but I was like, I don't know. On the 20s, yes, I can feel the difference. I'm not in as much pain and I'm much more relaxed. It's like having a bit of Valium every day, you know, so it helps me to stay calm and relax me. But yeah, I just gotta wait now. I don't know, I was so upset. I rang the head of the hospital and everything, so I'm like, how can you, like, it's the hospital's fault that you gave me an appointment. That was a phone appointment. It should have been face-to-face. If they had done the right thing, given me a face-to-face appointment on Friday, I could have been booked in for my procedure now. And now I've got to wait a month, and then I've got to wait 3 months for the procedure. So I've got to wait 4 months. So if I keep bleeding every day, that'll be 9 months of bleeding. I'm not impressed. I've had it. But that's my rant for today. I'm going to go and do some cooking videos now. I've been crapping on for 16 minutes. I just want to record this because I can't be the only woman going through this. If anyone's actually listened this long, I can't be the only woman going through this. You know, I'm scared of having an ablation, but I'm sick of bleeding and I don't want any more children. I want my health back. I want my life back. And once I do get healthy, like, I have to rebuild my life because, like, I've basically been in hibernation. Like, every time someone asks me, do you want to go out somewhere? Do you want to do something? I'll be like, no, I haven't felt well. I've been sick for so long and I'm finally starting to feel better, but I've still got a few more steps to go. But I just feel so isolated and so alone between caring for my children, and I love my children, but between caring for them and my son, I love my son, but he's a lot of work and it's not his fault. You know, he's a beautiful boy and I love him so dearly. I love all of my children so much, but he just takes a lot of extra work and he can't help it. You know, that's autism, that's ADHD, and I'm sure any carer would say the same, you know, but it does take a toll on you, and you have to carve out time for yourself and practice self-care, which is something that I have been taught. But when you're chronically sick, how can I? You know, all I've been doing for the last 18 months when I'm not with my children is laying on the couch mostly watching YouTube, and I've seen so many fucking episodes of extreme couponing and hoarders and all the rest of it. Like, that's all I've done. And like, I'm up on my feet now. I've been doing some cooking videos because I'm finally starting to feel better and get my energy back. But I'm just like, it's like running a race and I got this much to go. I just want to go and get my hair done and feel pretty and feel normal and just do things, anything other than just be stuck at home. So anyway, I'm getting there. I've got my hair appointment booked. I'm going to go into the gym next week. I'm getting there. I don't know, just, it's hard. Chronic illness is hard. It's hard being a woman. Quite sure if I was a man who broke my penis, I'd be getting help immediately. Oh, chronic health. Anyway, like I said, watch this space. I'm going to get healthy. I'm going to get on top of it. I'm going to lose the weight. I'm going to get fit. I'm going to get my ablation. And things will get better.